Okay, welcome everybody. We have a small crowd today, so at any point in time you guys have questions, please feel free to raise your hand and ask questions as we go through. But today we're going to talk about the natural solutions to infertility, so how to treat it. In June, I wrote an article in the Health Hunter about infertility, but more along the lines of the causes of infertility. So today I'm going to talk more along the lines of the treatments. You can go back online and read the article if you want. And that would be helpful. So the reason I really wanted to talk about infertility is not like it's a huge problem, but I'd say 25% of couples now are having problems becoming pregnant, and it is rising. And I've had a lot of experience with infertility, not because the patients were coming to me because they were infertile or having problems conceiving, but because of other issues. And working through their other problems, they then became pregnant. So a lot of times I tell women, when we start balancing out hormones, even though you think you can't get pregnant, you might, because it's happened a couple times with people with endometriosis and other female problems. So through that, treating the whole person naturally enhances infertility. So that's what I'm going to talk about today. So if I can get this to work. So this is what's on our agenda. I'll give you a little introduction to what is infertility, treatment options. So we're going to talk a little bit about all the treatments out there for infertility. And then I'm going to talk more about the natural solutions and ways to treat infertility naturally, which involve lab testing, supplementation, as well as diet and lifestyle. And I had a patient that was going to do a little testimonial, but I didn't change the slide. That was back in June when we were going to originally do this talk, but she couldn't do it today, so she will not be here for that. Okay, so what is infertility? So these are just the general definitions of when you're diagnosed with infertility. So if you're under 35 years old and a couple has not conceived after a year of conception-free intercourse, contraceptive-free intercourse, they are deemed infertile. Yeah, and if they're over 35, it's 6 months, and that's only because when you're over 35, they'll go to treat infertility quicker because you're older and your ability to become pregnant is already declining anyway. So that's the technical definition of infertility. So here are some of the causes of infertility. Ovulatory failure at 20%, and these are the causes in women. Tubal damage, that's your fallopian tubes that connect your ovaries to your uterus that the egg has to travel down. Endometriosis, which is a disorder where women have problems with endometrial tissue growing outside the uterus. So it could be all over the uterus, could be on the ovaries. A lot of times it gets on top of in the gastrointestinal tract. It can be everywhere in the abdominal cavity. And that's what endometriosis is. And then male problems. So a lot of times it is male problems. So not lack of sperm, but low sperm count, as well as sperm motility and the health of the sperm. So they actually watch how the sperm travel and stuff. And there are problems that can cause motility of sperm to be decreased. And then also a combination of male and female problems. And then a lot of them, 30% are unexplained. So in other words, we don't know what's causing the infertility. So that's especially where natural treatments can come in, because it's not one of these, and it's probably, where is it? Oh, there's another slide that talks about it. Probably some kind of toxicity or hormone imbalance that hasn't been diagnosed, okay?
So could people have some of all of that?
Mm-hmm. Yep, a combination of problems, yep. Fertility is definitely multi-factorial. So they could have tubal damage. Most of the time, tubal damage or problems with the fallopian tubes is from a history of pelvic inflammatory disease, sexually transmitted diseases like gonorrhea, chlamydia, which is pretty common. A lot of women have had that, and it damages their fallopian tubes. And so they'll go in, and I'll tell you in a minute, they'll go in and explore the tubes and look, and if they see damage, then you're less likely to become pregnant. But there still could be other problems as well. So, yep. And everything I'm going to talk about today goes for the male too, because it's important to treat this. Most of the time I see females, but it's important to treat the men as well. So these are the treatment options now that are available. Fertility drugs, which what they do is they stimulate ovulation, and it stimulates the woman to secrete more eggs at a time. So that's why you see a lot of multiple births nowadays more often, because a lot of people are using fertility drugs. This is kind of an aside, this was, 4 years ago, I had a young couple. They were coming to see me for something else, but they were 24, 25 years old, and they were trying to get pregnant. They had tried 9 months, and they still hadn't gotten pregnant. She was seeing me for something else, but they were telling me, and that when you take a holistic approach, I learned that they were having fertility problems, and they were about to start Clomid at 24, 25 years old, and through talking with them, learning about their lifestyle, they had told me that the husband was traveling a lot, was gone 2 weeks out of the month, and this poor couple didn't even, the OBGYN was going to start Clomid. No one had ever even told them, you would think they would know, but no one even had told them that you only have a 3-day window to get pregnant. So when looking at the schedule, they weren't even having intercourse during that time to get pregnant. So, once I educated them on the female cycle and ovulation and pregnancy, they got pregnant 3 months later. So even something as simple as that, this young couple didn't know about it, prevented her from going on Clomid. And, because Clomid is not necessarily the best drug. It can cause a lot of side effects and problems. And but surgery for structural abnormalities. So if there's something wrong with the fallopian tubes or something blocking or fibroids or something, you can go and surgically help that. Intrauterine insemination. So that's when they actually manually bring sperm into the uterus and do fertilization within the uterus. In vitro fertilization is where they actually fertilize an egg and sperm in a petri dish and then later on implant it into the woman. So that's an option to get pregnant, especially when a woman's having tubal damage and the egg is not even getting down to the uterus. That's one of the best options. And then natural treatments. And really, if natural treatments is what we're going to talk about today, is not just for infertility, it's fertility in general, to enhance your fertility, whether or not, if you're just trying to get pregnant and you want to get healthy, as well as if you do decide to do in vitro fertilization, it will help the success of the in vitro fertilization. And from a financial standpoint, even though it's out of pocket, most people pay $8,000 to $15,000 out of pocket for in vitro fertilization per attempt. And spending 6 months to a year costs way less than that from a natural. So I always say at least spend a year really getting yourself healthy even before you try all those treatments, because you could actually save a lot of money in the long run for it. And a lot of times I had a friend who went through 5 rounds of IVF, $12,000 per round out of pocket, and it's can be financial burden. Okay, so the natural approach is very extensive and individualized. Again, I said fertility is very multi-factorial, meaning a lot of factors can cause it. So and it can be very individualized. So you really have to do a holistic diagnostic approach, meaning looking at every single thing going on with the woman and the male and the man to figure out, what could be causing the infertility. So when you're doing a fertility or helping someone with infertility, I'm going to help them with everything else as well. So the only side effect of the program would be getting all your other health complaints better. So, which is probably not a bad thing, and a baby. So it's a high success rate with the natural approach because, like I said, there are a lot of factors that are causing infertility, and you have to take a holistic approach to help. And like I already said, it will enhance the success rate of IVF as well, which is in vitro fertilization. All right, so the natural approach. So there are 3 different steps to the natural approach: lab testing, diet and lifestyle, evaluation, and supplementation as well. Okay, and supplementation just means supplementing. It could be oral, it could be IV, IMs, herbs, all sorts of things that can help balance the hormones out. Okay, so here's some of the initial testing that would be very helpful for someone who is experiencing infertility and any type of those causes that I just said: endometriosis, polycystic ovarian syndrome, any other female problem. A lot of this can help. These tests can help with that. Nutrient panel would be very beneficial. In a minute, I'll tell you why these nutrients are beneficial. I'm going to go through each one. So knowing your level is important because then we can kind of pinpoint, well, okay, this is extremely low, and that might be why your husband's sperm count is extremely low, or why you're having endometriosis and things like that. Female hormone testing, blood or salivary testing can be done. Thyroid testing is very important because thyroid plays a big part in fertility. Thyroid plays a big part in everything, really. Adrenal testing, because stress is one of the main causes of unexplained infertility and a lot of other syndromes. So testing the adrenals, which is your stress gland, is very important, okay? Insulin resistance testing. A lot of times insulin resistance, most of the time insulin resistance is what causes cysts on the ovaries. So if you have cysts on the ovaries, a lot of times it's due to insulin sensitivity. So that's definitely something to check. And then your typical, CBC, complete blood count, metabolic panel, food allergy testing, candida antibodies are important because if you have a chronic yeast infection, that can cause problems with infertility. And then also heavy metal testing and other toxicity profiles could be considered. Okay, and it's good to do all of these at one time, but if a lot of times just starting with the hormone testing and some of the nutrients is all you need to do to balance everything out. But
so if you did all of those things, do you have an idea how much that would cost? Or is that
all of the labs, I kind of have a program, an infertility program designed out that I wanted to do here at the clinic that involved lab testing and visits and everything. And for a year, everything would cost less than $8,000 for a year for labs and visits and treatment and everything, including IVs and stuff. If you did the full bang, which is less than one in vitro fertilization treatment. So, but that's about what it would cost. All of these labs probably would cost $1,500 maybe.
What's the connection between cysts on the ovaries and insulin sensitivity?
If something with if the insulin isn't binding to the receptors, if it's not getting the glucose into the ovaries very well, if it's not getting glucose in, the receptors are sensitive to insulin, it'll cause cysts to start growing on the ovaries through that. I don't know the exact details of every step-by-step approach, but insulin resistance, that's why they put women on metformin when they have PCOS, polycystic ovarian syndrome, is because of that reason. They do that a lot. Okay, because insulin sensitivity is highly linked to cysts on the ovaries. And as well as iodine deficiency. Iodine deficiency tends to cause a lot of cysts to grow anywhere on the body, really, but even on the ovaries. Okay, so this is and you have, I think you guys all have this printout. This is how I would initially start from a dietary standpoint, the hormone balancing diet. In general, this is what I call the general diet plan everyone really should be on because everyone should have balanced hormones. So this is what I consider just a very general healthy diet. And eating plenty of fruits and vegetables, what does that mean? I always say at least 8 to 10 servings. People look at me like, wow, that's a lot. But you really, if you think about it, you can really get that in one day. Okay, if you eat one big salad at lunch, that's like 5 to 6 cups of lettuce. That's 6 servings right there. So, I mean, you can easily get it in. But trying to get in plenty of fruits and vegetables is important. Do you have a question? Did you have a question?
Well,
you look like you do.
Does it matter what the balance between fruit and vegetable is?
I always say more vegetables. 2 to 3 servings of fruit a day for most people unless they're more active.
And a serving will be like a half a cup? Or
like a medium size or a cup of strawberries, half a cup of blueberries. Yep. Eating complex carbohydrates. So I don't mean a lot of complex carbohydrates, but when you do eat complex carbohydrates, the ones that have the fiber still on them, the germ still on it, so brown rice, steel cut oats would be best, 100% whole grains, although I don't say eat a lot of grains because I don't think that's really good because it takes away from the vegetables you're going to eat. Eat all those grains. Buy organic foods when possible, especially dairy. So, and the reason I say that is because there's a lot of hormones and pesticides that reside in dairy, especially butter, which most people don't think about. If you're going to buy anything organic, buy organic butter, because that's where all the fat-soluble toxins are and the fat of the animal. So it's going to be higher amounts in butter than anything else. So that's at least one thing. And most stores sell it. I know Walmart has organic butter. So it's available out there. Eating, this is a big, I always get questions about this, phytoestrogens, soy, and there's so many different studies out there about soy and estrogen and everything. I was always taught that at least one serving of unprocessed real soy a day. So don't go soy crazy and eat everything soy, but one serving of soy can help high estrogen type syndromes, because phytoestrogens, from my understanding, tend to not bind as strong as a lot of the environmental estrogens and can help prevent your body reacting to all the environmental pesticides and plastics and things like that, and can be very helpful with dropping estrogen levels. So that's that, but that's one serving of soy per day. So edamame or soy milk or something like that. Eating oily foods, I'm talking about the good foods, not fried chicken, with essential oils. So essential oils are very important. Fish, there's some in walnuts and seeds and oils and grass-fed meat. And essential oils are important because they're essential, and I don't think many people understand what that word means. So essential means that you have to get it from your food. It is essential for life, yes, but you have to get it from your food, because even though your body is breaking down fat, it's not going to break down and produce omega-3s and the essential omega-6s. So you have to get it from your food. Same thing with the essential amino acids, the proteins. You have to get it from your food. You can't break down muscle for those. So you can have severe deficiencies over time with malnutrition and not eating protein and stuff like that. So eating the oily foods is very important. I see that's one of the biggest problems I see, is people not eating fat. So salmon, fish oil, nuts and seeds, avoiding fat because they're trying to lose weight. And especially women with endometriosis that are told to lose weight, they first go to avoiding all fat, and that's not always the best route. Reducing your intake of saturated fats, important, especially in dairy products. Okay, so I do see a lot of women of reproductive age eating a lot of dairy because they're told eat a lot of dairy for calcium and stuff, and so probably not the best thing in my opinion. So drinking enough fluids is important. Increasing your intake of fiber, and fiber does a lot besides bulk up your stool. So it's important for keeping your gut flora healthy. That's really, really important for hormones and processing estrogens out of the liver. If your gut flora is not healthy, you're going to have a backed up liver. So you're going to have your estrogens are going to start being reabsorbed, and you're going to, over time, your estrogen levels will start increasing. It doesn't happen overnight, but that's important, having those good gut flora. And sure, you can take gut flora, but trying to get it to naturally produce is important. And the gut flora also help your immune system and help vitamin production, and especially vitamin K, and some other nutrients. So that's very important for the fiber. So a lot of people just think fiber and getting rid of cholesterol and bulking up your stools, but it does a lot more for you.
Difference in the quality of the fiber?
I always say, I was taught that it's all about the fiber to sugar ratio. And grains have a lot of fiber in them, but they have a lot of sugar. So the best sources of fiber were always in things like, and vegetables in general are the best source of fiber. Even though if you look on a fiber chart, it says, broccoli has 3 grams of fiber, but wheat has 15 grams of fiber. But you got to go and look at the sugar content and the ratio of it. So I always say vegetables. So people always say increase your fiber. They start eating a lot of grains and wheat and oatmeal and everything that's marketing. Marketing is going to be on processed foods, and you're not going to see high fiber written on, broccoli in the produce section. So.
And if you supplement with fiber, are those all the same?
You can help, So by supplementing fiber, that can help in the short term, but you still want to get your lifestyle where it should be, where you're getting enough fiber in naturally, but that's important. Just be cautious, because then they put a lot of sugar and artificial sweeteners in those fiber supplements, and sometimes too much fiber can cause constipation too. So people that have constipation have hormone imbalances a lot, and they take a lot of fiber, and sometimes it can constipate them even more. So you got to be careful with fiber supplements. Okay. So, and number 9, which in my opinion should be number 1, avoiding, if anyone's who ever been my patient will know that, avoiding additives, preservatives, chemicals, artificial sweeteners. And you guys can watch my food additives talk as well, and I have handouts on that too, but that's really probably the most important thing in your diet, is avoiding all the processed food. Because if you do that, you're going to be naturally doing a lot of the other stuff, okay, and getting more nutrients in. So Those chemicals, in my opinion, are not good. There are thousands out there, so it's hard to avoid them all, especially with the way our lives are. But you can avoid. I have the top 12 I talk about on my talk. So those are probably the most important ones to avoid. But that's really, in my opinion, number one. Reducing your intake of caffeine. Okay, so probably a cup of coffee in the morning is fine. A cup of coffee in the morning is fine, but a lot of people drink way more caffeine than that. Tons of soda, coffee all day, and that's not good for fertility. And it also will eventually decrease your, especially soda. It's not that soda's bad because it's just empty calories, but also say you're drinking even one soda a day, which is 150 calories, which is about 10% of most women's daily intake, or what should be their daily intake. You're not only not getting the nutrients, but your body has to process that and utilize a lot of your nutrients that you're getting in other foods. So you're wasting vitamins, B vitamins especially. So you can deplete yourself of B vitamins by eating a lot of empty calories. That's probably one of the most, alcohol and empty calories are one of the most common causes of B vitamin deficiency, especially thiamine and stuff. So because you're using all your Bs to process it. And you're not getting Bs in it. So usually when you eat food, it has all the vitamins and stuff to process that food with it. So reducing alcohol intake is, of course, important. Avoiding sugar on its own and hidden in foods is very important. Okay, so,
There's tons of it.
Yeah, and I had a patient yesterday tell me, but sugar is natural. And I'm like, yes, it is. But have you ever chewed on sugar cane? It's a stick. Like I said, the sugar to fiber ratio, if you ate sugar in its natural form, probably is good and pretty healthy. It's got a lot of nutrients and stuff. So, but not refined sugar. Okay. Stevia is probably okay, yes. For what we know now, I mean, stevia is a plant. It's not an artificial sweetener. And it's also shown to have a lot of anti-cancer from the research I've read, stevia. But that could, as we do more research on the plant, that could change. Maybe Nina knows some about that, but no. So anyhow, it does have a lot of anti-cancer benefits and immune-stimulating benefits, stevia does. Okay, so that's all about the hormone balancing diet, and you guys have that handout with you. Okay, so I think a lot of this I've almost talked a little bit about, but alcohol, of course, not good, and I don't mean you have to avoid all alcohol, but less than 5 drinks per week is really ideal. So if you go out one night and have 2 or 3 glasses of wine or whatever, probably okay. You just don't want to be drinking all the time, especially men, because alcohol consumption will drop sperm count dramatically in men that drink beer all the time. So, and testosterone levels. So like I said, causes decrease in sperm count, decreases motility, and alcohol, again, is empty calories, like I just talked about that, and it decreases absorption of zinc in your stomach. So if you're drinking it with your food, you're not going to absorb a lot of the zinc, and in a minute I'll talk more about what zinc does, but zinc is very important for sperm production. So, okay, caffeine, I talked a lot about that. Again, affects sperm. Raises stress hormones in the body too, and I talked about cortisol, stress, high cortisol. If the more your body's making of cortisol, the lower your progesterone is going to drop, because it's utilizing progesterone to make cortisol, so that can cause short menstrual cycle, progesterone deficiency, estrogen dominance. And again, all of this is so multifactorial that caffeine can do that, and so that's soda, chocolate, tea, and coffee. Okay, xenoestrogens, and I talked briefly about that. Xenoestrogens is just a fancy word for environmental estrogen. So a lot of chemicals in our environment are estrogen-like. They look a lot like estrogen, and they combine to your estrogen receptors and cause you to have high estrogen type symptoms and problems. So that can cause hormonal imbalances, more estrogen dominance. And the best way to eliminate these is just to buy organic when you can and not store things in plastic. Glass would be better. Don't heat or freeze things in plastic as much as you can. You probably can't avoid it 100%, but you can start making changes to lower your exposure. And I have, I believe Tiffany printed out a handout for you that talks about estrogen, environmental estrogen. So if she didn't, I can send it to you if you want it. Okay, smoking. Smoking, of course, not good for getting pregnant. Actually, the nicotine metabolite, cotinine, which is a metabolite of nicotine, causes problems of the follicles and the ovaries. from producing. So that could cause ovarian, or decrease in, what am I trying to say? Low ovarian reserves. So it stops the follicles from developing every month. So you'll have less follicle development, less likely to get pregnant. Okay. So, and people who smoke are 3 times more likely to have problems conceiving. I had one patient that had a problem conceiving, stopped smoking, got pregnant within a couple months. So I was seeing her for something else, but she told me that story. So very important. So these are the supplements that are the most important for fertility and enhancing one's fertility. Doing the nutrient testing is important because it's always individualized, because all these nutrients kind of work together. But from experience, my experience and other practitioners, these are the most common supplements that one would want to supplement with that are trying to get pregnant. Okay, and we'll go through each one. So folic acid, I'm sure you guys all have heard of folic acid. Spina bifida, it can cause if you have a deficiency during pregnancy. So most prenatals always have 800 micrograms of folic acid because that's the standard dose you want to be on. But folic acid is important for DNA and RNA production. So deficiency can cause a lot of genetic defects in a fetus, and then also a lot of spontaneous abortions and stuff, or early on abortions. So you always want to take it with other B vitamins, especially B12 and B6 when you take folic acid. So a lot of times it's always in a combination of all of those together. Zinc. Again, zinc is really important for cell division. So especially for sperm, because there's always a lot of cell division going, because sperm production is always happening, and also developing fetus, of course, because you're having a lot of developing cells. It's good for a lot of epithelial cells, so skin health, GI health, zinc is always important for, but a deficiency, even as just a zinc deficiency alone, can cause infertility. So measuring your zinc and taking zinc is important. It's highly concentrated in sperm. If you measure the zinc level in sperm, it's very highly concentrated, and it can increase your sperm count once you start taking it. So, and I put some of the average dosing on here, what one would take, 30 milligrams a day. I always say zinc, stay away from zinc oxide. It's not really absorbed. Other forms of zinc are better.
How do you get zinc in your diet naturally? Is there food?
Leafy greens, nuts and seeds, things that people don't eat a lot of. Yeah, those are the highest amounts of zinc in those things. And also in meat products, you'll get a lot of zinc. Shellfish as well, shrimp, crawfish. Selenium. Selenium is a fantastic antioxidant. It prevents chromosomal damage from toxins and other radicals, and other free radicals. So all of these antioxidants in general, you know, chemicals and stress cause oxidation. So you want as many antioxidants as you can for general health, but especially for fertility and while you're having a developing fetus. It's important for proper thyroid function. So if you're ever having a thyroid problem, or we see that, selenium helps with the conversion of inactive thyroid to active thyroid. Very, very important. And it's very important for testosterone production in men, selenium is. So if you have low testosterone, getting selenium up is a natural way of increasing your testosterone levels. So 100 to 200 micrograms a day is what most people would take for. You can have a toxicity of selenium. You see it in certain countries where there's a lot of selenium in the soil, so you certainly don't want to overdose on selenium, so you want to stick to that. And testing your selenium levels would be best, so you know where you are first. Essential fatty acids, I talked about that already, okay, how important it is for essential fatty acids, especially flax seeds in women. About 1 to 2 tablespoons a day of flax seeds can help lengthen the cycle, the woman's cycle. So if you're having a luteal phase defect or around a 21-day cycle, flax seeds can help lengthen that cycle. It helps delay ovulation and then in turn raise progesterone levels so you can lengthen your cycle. All of these things can take about 3 months to start working, but flaxseed very important. Flaxseed is very similar to fish oil. It just has some other components to it, and it has to be converted through several steps to get to the oils, that fish oil you get directly. So a combination of both of those is good. Okay. And most every American is deficient in essential fats. Okay.
Got plenty of others, just none of these.
Yes, not the essential ones. And surprisingly, you know, people that avoid fat because of heartburn and all that problems, they do not get heartburn with the good fats. Salmon, olive oil, You know, I had a couple patients test that, pour olive oil all over their vegetables and eat it, see if they have the reflux. They don't have it. So it's not just about it's about the type of fat too and the pressure difference. But anyway, I digress. So fat's important in the diet, and most people don't get enough. Okay, vitamin E is an antioxidant. Again, you need a lot of antioxidants, especially when you do have a lot of exposures. We need even more antioxidants than our ancestors did 100 years ago. And deficiency can promote early menopause in women. So if you're going through perimenopause at 36 or 37 years old, that is not common. Even if your mom went through it, you know, figure out a way, figure out what's going on to balance out your hormones. Okay, 400, 800 I use is about average. So vitamin C is good for everything. Antioxidant, enhances sperm quality, and it prevents sperm DNA damage. Okay, and miscarriage during pregnancy. So 2,000 plus milligrams per day is what I always say to be on in divided doses. But I have some people on way more than that. So, okay, L-arginine. That's an amino acid that can be very helpful for increasing sperm count and motility of the sperm. So this is more for men. And about 16 grams a day, which is a high dose of L-arginine. It also helps with blood pressure. It helps with ED, erectile dysfunction as well, arginine can. But a note is not to take during chronic viral infections, especially herpes infections, whether it's genital herpes or cold sores or any type of chronic viral infection, you don't want to take L-arginine, okay? Because it throws off the L-lysine ratio. I don't know if you know L-lysine is really important it can help with cold sores. You've probably seen lysine cream and stuff like that. It throws off the ratio and can make you have an outbreak, or more likely to. Okay. So L-carnitine is also important. You probably have heard of L-carnitine. Basically, L-carnitine is the molecule that brings fat into the metabolic. It helps metabolize fat for fuel. So it's really, really important for sperm and the reproduction and the production of sperm count. So that can help increase sperm. We use it for chronic fatigue. We use it for a whole lot of things, acetyl L-carnitine. Acetyl L-carnitine is the best form, by the way. So if you're going to buy it, acetyl L-carnitine is more absorbed than L-carnitine. So if you ever wondered what the difference was, it's about the absorption, okay? So vitamin A. Vitamin A is very important. You probably hear avoid vitamin A in pregnancy. And high doses are contraindicated in pregnancy. More than 10,000 IUs a day of pure vitamin A you don't want to go over, but you need plenty of beta-carotene, which is a precursor to vitamin A. The precursor to vitamin A is not going to cause a problem like vitamin A will, okay? So getting enough beta-carotene is extremely important for pregnancy and maintaining a pregnancy, okay?
So then are you suggesting that people take beta-carotene as opposed to taking vitamin A?
Mm-hmm. Yep. Or usually it's in a multi, and it's beta-carotene. So if you see vitamin A as beta-carotene, don't get worried about it when you're trying to get pregnant. It's not going to cause a problem, okay? And so that's the end of the nutrients. And I do want to make a little statement about pregnancy and nutrition. You know, when you're pregnant, you need an average of 300 more calories a day on average. And it's really important that calories always come from nutritious food, because if it doesn't, you're more likely to have problems post-pregnancy, and I see it all the time in women, because their bodies become depleted because all the nutrients go to the baby. You know, the baby's gonna be spared, and the woman's gonna experience all the problems with malnutrition in pregnancy. Or, you know, a lot of women I see will eat a lot in pregnancy and gain a lot of weight, but there's a lot of empty calories, you know, Slurpees and you know, things like that is just going to cause problems in the woman later on. So you want to avoid all that, because empty calories deplete your body and it can cause problems in pregnancy too, especially if you're already depleted.
So pickles and ice cream are not part of the pregnancy diet?
No. As long as it's real good natural, you know, ice cream that doesn't have all those fillers and fake fats and fake sugars and all that stuff in it. So if it's 4 or 5 ingredients.
Premium Briars?
Yes. No, Premium Briars is not good either. Bluebell, probably natural Bluebell is probably one of the better ones you can buy in the store, but no, Briars has additives in it. I've read the label of it. I don't like it. So, but anyway, every now and then that would be okay.
How about the pickles?
Probably okay. As long as there's no green and yellow dye in pickles, because you find green and yellow dye in pickles. Look on the store, next time you're at the store, there's yellow number 5, I think, yellow number 6, both in all pickles. So avoid that. That's really bad for especially nerve problems and ADD and stuff like that. So start reading your labels. You'll be very surprised.
So we should be looking for clear pickles? Or?
No, a lot of the natural stores don't put the green dyes in them. They just don't look as, green as what you're used to. Yeah. Yeah. They only put it in there so you're more apt to buy it because you're naturally attracted to very colorful foods, which most healthy foods in nature are very colorful, but they're trying to sell their processed foods so they color it. And because the anthropologists know all that. They're in our minds. They know how we're going to buy stuff. Okay, so that's a lot of the nutritional therapy. I'm going to go into some of the herbals that I use a lot. Vitex is probably one of my most favorite herbal supplements that I use for helping people get pregnant, as well as other female problems. Amenorrhea, lack of menses, this is fantastic for. I've never been able to not get a woman cycling using Vitex. But this is a little bit about it. It stimulates proper function of the pituitary gland that talks to your ovaries and gets your it basically stimulates release of LH from the pituitary gland. So if you're experiencing amenorrhea and want to get pregnant, lack of period, lack of menses, then this is one of the best herbs to take, as well as if you're having a shortened cycle, low progesterone. It helps raise progesterone, which can bridge the gap of that estrogen-progesterone ratio, which makes you less estrogen dominant. So this is one of the better one of the best herbs. It also modulates the secretion of prolactin, and that can cause a lot of infertility problems. It's the one time it's contraindicated in people that are on Parkinson's meds, stuff like that. You don't want to take that one. That's basically the only time you don't want to take Vitex. It regulates your periods, which I just talked about. It restarts periods once they have stopped. So a lot of women that have gone through eating disorders or do excessive exercise and are trying to start their periods back, this is one of the best herbs to use. Helps with heavy bleeding, and again, increases the ratio of progesterone to estrogen like I talked about. So fantastic herb.
Will that help with endometriosis?
Mm-hmm. Yeah, it sure can. And again, only use under supervision of experienced practitioner. I'm going to say that for all the herbs because there is a definite art to using a lot of these, but you can buy them over the counter too. That's just my disclosure.
Question.
Uh-huh.
So someone that's postpartum, if they started taking Vitex to try and sort of, your hormones are insane after you have a baby, would this restart your period?
Or if you're nursing, are you nursing?
Right.
I wouldn't take anything while you're nursing. Okay. I would honestly let your body try to regulate itself right after post-pregnancy.
Well, Vitex is also supposed to be good for lactation.
Mm-hmm.
So, I mean, it seems strange to me.
No, I don't know about that. I wouldn't take it. I wouldn't take it during.
Because I know the things that are good for lactation are things that are estrogenic mimicking, and so that's why your body produces more. That's why women that eat meat tend to produce more milk is because they're experiencing that, extra intake of hormones, and so.
Well, Vitex can actually drop prolactin levels, so it doesn't act as an estrogen type mimicker. So it's a little different. It's more addressing the pituitary gland. I wouldn't use Vitex while you're nursing, and I would actually wait a whole year after pregnancy to start trying to balance out your. If you don't have a cycle after a year, then start doing. I would do everything else first, in my opinion. But
women are not interested in restarting their period, but
sure.
are more interested in not having hot flashes and sweating profusely, et cetera, et cetera.
Right, exactly. There are other ways like flaxseed and evening primrose oil and other, which I didn't talk about evening primrose oil, but that's also helpful as well. Even black cohosh or something I would rather use than Vitex for that reason.
So do you take it to try to get pregnant if you get pregnant? Do you take it?
I always say stop it right when you find out. Now, if you're taking it for a week and you didn't know you're pregnant, that's fine, but you want to stop it after that. And if someone has progesterone problems and they need to get on progesterone shots or cream to help maintain the pregnancy, then that would be something you would switch to at that point. But, yeah. Okay, so black cohosh, there you go. Stimulates secretion of LH, kind of like Vitex, but it doesn't affect prolactin level. So I would say that would be much better for postpartum and hot flashes and feeling hot at night. That's just a common side effect of your hormones changing. And really, after about 3 months, if you're still having the problem, then I would seek treatment. But it's been that 3 months just kind of dealing with it. But I've been to that. I know what you mean. So especially valuable for older women, 40 plus, trying to conceive. Black Cohosh can be very helpful. It's great for hot flashes and night sweats too when people are going through menopause. Okay, but if you're post 40 and trying to conceive, Black Cohosh is very beneficial. Rhodiola. It's a great herb. I use it a lot for adrenal support. It helps with modulating cortisol levels. It's an adaptogen, so it adapts. So it's great when you're going through stress to use rhodiola. It's also known to help increase testosterone levels and libido and things like that in men. So I use it a lot for testosterone levels in men and helping. Rhodiola is fantastic for that. In women as well. I'll use it to raise testosterone levels. So other beneficial herbs, dong quai, blue cohosh, cramp bark, false unicorn. Those are other herbs that can be used. I'm not going to talk much about those, but those are some that are great to use during when you're having problems with infertility. Dong quai is just natural progesterone. That's usually what's in bioidentical progesterone creams and stuff like that. Sweet potatoes too, or have a lot of progesterones in them as well. So let's see. There's a couple other things I want to make sure. So other natural treatments. Exercise is very important. I didn't write it on here. I don't know how I missed that. But being active is very important. So there is some studies that have shown that 4 hours or more of exercise a week can actually decrease your fertility. But those studies in those women, they think the problem was that they were exercising a lot and not eating very well. When you're exercising a lot and not eating well, you're going to have more health problems in general. So exercise is great for health and weight loss and exercising your heart and everything. But if you're not eating well and your body needs to repair itself after exercise, you're going to have more problems. Your nutrients are going to be depleted. You're going to be more at risk. So if you are an avid exerciser, you're even more, you have to watch your diet and eat better, even more than the person next to you that doesn't do anything. Okay? So acupuncture, very good for infertility. So can be very helpful for enhancing fertility. Relaxation techniques, biofeedback, deep breathing, qigong, meditation. I mean, stress in general. You're not going to get pregnant when you're stressed. Your body is saying no to pregnancy when you're going through a lot of stress. So you have to do these type of therapies. They can be very helpful. Manual soft tissue therapy for pelvic adhesion. So if you had a lot of endometriosis or surgeries and you have a lot of adhesions or scar tissue, there are a type of manual therapies that can help break that up. Gluten avoidance and treatment for celiac disease. So that's a biggie. So a lot of women with celiac disease and irritable bowel and constipation always have fertility problems, hormone problems. So, and regulating your bowels is extremely important for hormones. If you're constipated, if you're not going to the bathroom every day, you're going to have hormone problems. And most of the women I see with endometriosis or high estrogen problems, infertility, most of them, not all, but they all, for the most part, have had a history of constipation, problems with their bowels. So, real important
You say
for that.
gluten avoidance. I mean, what do you, I mean, it's in everything.
Mm-hmm.
Labels.
It's in most all processed food, yeah. So going back to the basics, fruits and vegetables, nuts and seeds, beans, legumes, lots of good oils, olive oil, olives, meat, preferably grass-fed meat. All those things are naturally gluten-free. Potatoes, hummus is one of my favorite sources of carbohydrates and good fats. I love hummus.
Because isn't the incidence of miscarriage higher?
Celiac disease and stuff?
Yeah, and I guess I don't understand the difference between celiac and gluten, allergies and gluten intolerance.
Right. So celiac disease is actually when you eat gluten, your body attacks the small intestines, not just the gluten molecule. And then you start having malabsorption problems, which can cause hormone problems, migraine headaches you see a lot. Usually constipation and migraine headaches are the #1 presenting factor for celiac disease, not diarrhea and weight loss. And a lot of people actually gain weight with celiac disease. So it's not your textbook.
I know somebody that they had, they did a test, they sent it into a lab in Dallas, and it says below 10 is normal, and theirs was 147. But it said they weren't really celiac, so I guess they're trying to figure out where.
They were probably more gluten sensitive. They weren't having the antibodies that were attacking the small intestines. But celiac disease is a hard one to diagnose. Really gold standard is biopsy. But even then, biopsy, you know, if they get the wrong area of the small intestines, they're not going to catch it, you know, because a lot of times those microvilli start blunting in certain areas, and you might biopsy the wrong place. And it's hard to see by the naked eye. So when you go in there and do a scope and biopsy, you know,
But she's also had several miscarriages.
yeah. And if they're early on, that could be also low progesterone or a lot of other things. But, you know, you'd be surprised by how getting these nutrients leveled, you know. I mean, I see some really miraculous things happen, to be honest. But even like a simple zinc deficiency can start regulating someone. But those are some.
Manual soft tissue therapy for pelvic adhesions or like, what is that consistent?
You know, I don't know all the details about that. I know several women that have gone through that. I don't personally do it, but I know a lot of massage therapists. A lot of women have gone and done this therapy, and I've heard other practitioners talk about it. But I personally haven't had much experience with it in patients. But from my understanding, that you're trying to break up the adhesions, open up the female organs, and so that everything can flow properly. But
Put some sort of a massage.
yeah. So, and I have. So I don't know what I wrote here. I forgot. But I have a. Do you want to talk, Nicole?
What do you have, Dr. K?
I have one of our fantastic nurses, Nicole, here. She's going to tell her little story with working with us and with she had problems with fertility and stuff, and have a little talk about her experience. So, do you want to talk? I would be honored if you would.
So my story is, goodness, it's my son will be a year next month on the 9th. And we tried, when I got back home from overseas, we tried for 4 months to have a baby. We were unsuccessful. I even had a miscarriage almost a year to date from when my son was born in September. It just seemed like problem after problem, nothing was happening. Did blood levels on me, did nutrient levels, everything seemed to check out fine. And then I had an appointment with Dr. Honeyhockey, and he diagnosed me with polycystic ovarian syndrome. I had a lot of inflammation in my body. I had a lot of fluid retention. So he suggested me to start the HCG diet. So I started the HCG diet. I lost 27 pounds, and his main reasoning for doing the HCG diet for my particular problem of not being able to get pregnant was visceral fat. The bad fat in your body releases cytokines in your body that's attacking the main place it attacks is your pancreas. So I was 35 pounds heavier than I am now, and my blood sugars weren't regulating because it was attacking my pancreas. And so it helped by losing that weight. I decreased that inflammatory response, regulated my blood sugars, which helped regulate thyroid and other hormones that weren't tested but could have been off, that was preventing me from getting pregnant. So I lost weight, and Dr. Ron's main thing is not only checking the woman but checking the bull, because it's easier to fix the bull than it is the woman. So he suggested getting the bull checked. We got the bull checked, and he had some motility issues in his counts, motility issues and lower counts. And they usually say, the doctor that we had the analysis done through said anything less than 3,000 or something like that is considered abnormal, and he was less than 3,000. So he spoke with Dr. Honeyhockey again, and he actually just gave me a book and had me read up, and I read up on it, and we started him on a calcium, magnesium, and zinc supplement. The zinc is supposed to help increase the number of motility cells or sperm cells, and vitamin C and he took vitamin C 3 times a day, and it's supposed to kill abnormal cells. So you're getting rid of the bad ones while increasing numbers and motilities of the good ones. So No, because you know, when you're that adamant and you see how sad the cow is, then the bull's really willing to work. So he was willing to do that. And the easiest, most simple thing that was overlooked is, I call them whitey tighties, but the old school tight underwear, because heat breaks down protein, and sperm is a protein. So we swapped to boxers, and numbers almost skyrocketed, I would say, after that, because we didn't have any problem. After a month, I was pregnant. So that's my story. I had a healthy, adorable boy, and a happy husband, because my boy looks just like him. And he's a good baby. So it helped a lot. Taking care of myself. When I did the HCG diet, I learned, what not to eat. I don't drink pop anymore. When I first came here, I was drinking pop. Don't drink pop anymore. I used to get migraines, and now I know pop was my trigger. And then just doing the HCG, you learn what to eat, what not to eat. The boxed foods, all the preservative foods. One tortilla has like 360 calories in it. So you learn to, when you're going to Chipotle, don't do the burrito. All the carbohydrates and stuff that your body doesn't really need. Your body's, that's also your pancreas is having to release that insulin to help digest and break down those sugars. So you're putting in more than your body needs. And you're learning, I learned that through the HCG diet. Throughout my diet, or throughout my pregnancy, I continue to eat how I learned how to eat from the HCG diet, eating a lot of green vegetables, a lot of high fiber foods, what good proteins to eat, what good fats to eat, instead of cooking with oils or using an alternative. Dr. Kale has taught me what virgin oil to cook with, and what should be cold and what should be hot. And then your good fats, like your avocados and stuff like that. So good fats, good nutrients for your kids and for the development of your children was a big deal throughout my pregnancy. So that's my success story. Hopefully we'll have another one soon.
Another success story?
Yeah, another success. Well, any baby's a success, right?
Does the bull like being called the bull?
He was okay with it. He was okay with it.
Thank you, Nicole. Do you guys have any questions for either myself or Nicole or? Any questions? And I'll stay longer too if you have more personal questions you want to ask or something. So, well, thank you guys for coming. It's a pleasure.